Okay.
Students, kindly tell what is fungating wound or cancer wound. Can anyone tell? Can anyone unmute your mic or you can leave the comment?
Uh, Wound caused by fungal infection, ma'am.
Wound caused by fungal infection. Okay. Then, can we take the fungal infection as this much level serious? Serious one? Okay. I'll give explanation. A fungating wound is a skin ulceration. Okay. It is caused by an underlying cancerous tumor that has broken through the skin surface. Okay. Skin tissue surface, skin cell surface. It is happening. Again, I am telling a fungating wound is a skin ulceration caused by an underlying cancerous tumor that has broken through the skin surface or skin tissues or skin cells. The malignant tumors are broken into the skin. That is called fungating ulcer, fungating wound, fungating malignant wound. So you can see clearly in this picture how it is appearing. Okay. So it refers to a malignant process. It is involving both ulceration and proliferative growth. Okay. This shape will be cauliflower shape and it is showed as a nodular fungus. Okay. So this is what called
Revati ma'am. Are you here?
So, as a malignant tumor grows, it blocks and damages blood and lymph vessels under the skin. Okay, first step is the malignant tumor. When it is time to grow, it blocks the damages and blood and lymph vessels under the skins. So, uh, nodules will be enlarged. So, it will leads to the disruption of capillaries and lymph vessels. That's why it blocks that's why it blocks and damages blood and lymph vessels under the skin. Okay, so the damages which has happened to the capillaries and lymph vessels that will be altered coagulation and disorganized circulations of the particular area. You have to understand, through the disruption of capillaries and lymph vessels, the coagulation of blood vessels got altered. Okay, that's why we are getting that cauliflower shape. Okay, that skin structure, cell structures also will be changed. Okay, that will lead to the tissue hypoxia because we need a structured capillaries, structured lymph vessels to maintain a nutritious blood vessels. But here, disturbed blood vessels that will lead to the tissue hypoxia and necrosis itself. Okay, cell death may cause in this situation. Okay. So here, the fungating wound creates an environment ripe for bacterial colonization. Okay, I have not mentioned in that PPT, but you have to note that it is creating an environment which is suitable to the malignant growth through the skin, like how the tree is giving some roots, no, like that it is creating environment. Okay, that is full and full with the help of bacterial colonization. Okay, which often causes an unpleasant odor or exudate. Okay, the bacterial colonization also caused the unpleasant odor and exudent. Okay, then it is otherwise called Marjolin ulcer. So Marjolin ulcer is otherwise called ma'am, little enough ma'am. It is a type of malignant changes in skin, okay, in a chronic wound. Okay, burn scar, pressure ulcer, venous leg ulcer. Previous one, it is also one type of fungating ulcer, but it is happening in the prolonged time chronic wound. Okay, previous one is suddenly it will happen through the malignant wound, but second one, Marjolin ulcer, is happening through the prolonged time chronic time wound or scar. Okay, untreated wound also will leads to the Marjolin ulcer. Okay, that's why we are taking care of chronic ulcer patients to treat them properly to prevent from the Marjolin ulcer. You have to know the difference between the Marjolin ulcer as well as the fungating wound. Okay, Marjolin ulcers pathophysiology here. Appearance of moss in the wound. Then onset of wound pain not previously present, change in the character, volume, appearance of drainage. Okay, prolonged time the patient is having that ulcer. Okay, that won't give any pain, that won't give any exudent, that won't give any odor, that won't disturb patient until the physiological changes happening. Okay, after the changes happen, the Marjolin ulcer is developing through the symptoms are pain exudates. Okay, so the patient should take the biopsy of the wound immediately. Next one. Okay, before entering into the problems of the person who is having fungating wound, we have to know about the causes of fungating wound. Okay, so already we have studied cancer cells invading and destroying the skin and underlying the tissues. Okay, so that is creating the wound like structure, that is creating cauliflower like shape and all. So the tumor grows through the skin surface, creating a wound that can be become infected, more infected. So that's why I have said bacterial colonization word. Okay, so these wounds result from the tumor blocking blood vessels, necrosis necrosis area, necrosis wound, and it is considered as a devastating complication of cancer, which is primarily seen in the last 6 to 12 months of life. Okay, so if the patient is coming with any malignant tumor, but the skin is started to broken, we have to notify immediately. We have to start our primary care to the wound. Okay, we should not leave the patient. This is just a small wound, like that we should not leave the patient. Okay, so main causes is the tumor cells are destroying the skin, overgrowth of cancer cell. Okay, over proliferation of cancer cells, malignant cells also leads to the fungating wound or Marjolin's ulcer. Okay, the metastasis are also main reason to make the fungating wound on the patient skin. Okay, now we are going to discuss about the problems which are all faced by the patients. Okay, so already we have studied palliative care is a holistic management. So we need to meet them physical needs, psychosocial needs, psychological needs, social needs, and spiritual needs. So problems they are going to face in physical means, ma'am, please scroll here. First, physical problems. Patients are going through pain. Okay, they may feel the intense pain. You have to assess the pain with the help of pain scale. Okay, malodor, bad smell will be there. Then bleeding, exudates, because the bacterial colonization and infection invading, that will cause the exudates. Bleeding, small capillaries will be affected, so bleeding will be there. And itching, because of the rupture of the blood vessels and rupture disruption of the skin surface. Dry skin will lead to the irritation. Infestations with maggots, already we have seen the small wound is enough for mosquito or any type of small insects to manifest the to hatch the egg, so it will lead to the maggots. Okay, then communication difficulties, if the wound is present on the vital organ or vital places, if it is placed on the face or near to the mouth nose, means they will have a communication problems. Most of the fungating ulcer we have seen in our hospital. Now I'm working in a KMCH hospital. It is a medical college. We are seeing many patients who are having fungating wound near to the mouth only. Okay, they are having more difficulty in communication. Okay, so these are all the physical problems patients are facing here. Then psychological problem, altered body image, sexuality and denial, fear, depression, anxiety, shame and guilt. What is the meaning here? Altered body image means their physical appearance will be changed through the malignant growth. That wound growth will disturb the patient's facial appearance and all. Then sexuality, then if the patient is if the patient is female, means they may feel more guilt about their appearance. Their intimate with their partner will be decreased here. Then denial, they are getting fear. They many of the patients got denial from their own family members because of the wound appearance, because of the smell, because of the fungating ulcer, because it is giving a disturbing image to the patient, so the patient may feel denial. Okay, then fear, the patient is feeling fear because they don't have any wound, just they have some pain and all. Maybe sometimes in majorly ulcer they don't feel pain also. See, suddenly they are getting pain, they are getting bleeding, they are getting exudate. It will lead to the high level of anxiety to the patient. Okay, then depression and anxiety. See, our own family members and society, it is denying us, means we will develop the depression and anxiety. So it is very common in every patients. In fungating ulcer patients, body images disturbances also there, so they are feeling more depression and anxiety than the other patients. Okay, then shame, guilt. Oh, why it is happening to me? I did something wrong. Like that, they may felt guilt. Okay, so they are facing physical and psychological problem. We have to address the both problems. Okay. Next, ma'am. Then social problem, family isolation. Previously, I have said in psychological problem, patient's family may think it is contagious. It will spread to us. Then patients' disturbed images will disturb their mind, their peace. They are denying the patients. They have started to they won't take care of the patients. Most patients, they won't take care because of smell, because of lack of awareness. So social problems also, they will appear, it will appear there. Then social isolation, if the patient family is taking care of them also, but the society will isolate them. Oh, they are cursed family, they are full and full deceased family, so we should not talk to them, it will spread to us also. Like that, many of the people will treat them very low, so they may feel social isolation. Then social stigma, fear of contagion. Yes, they think fungating ulcer is a communicable disease. It will spread to us. It will spread to our children. Like that, they will think. Then effects on family, effects on sexual relationship, and marital disharmony. If the patient, if the spouse or partner may deny them because of the appearance, because of the smell, because of the odor, they won't give the proper care and love. So they may feel the disharmony in their relationship or marital relationship. In spiritual, they are facing interference with the religious rites. They can't do the religious activity regularly. They can't be able to go to temple. They can't be able to read books. They can't do their religious rituals. They may feel God is punishing me, so God is doing bad to me, like that they may think. Okay, so fear of impending death. Oh, what will happen after the death? What is happening to me? Oh, this is my death law. Like that, many things the patients may think. Okay, we on example, we have seen one patient who is 42 years old. He is a flower seller in front of temple. He is working on a temple from the age of 6 years. Okay, 6 years, from 6 years old. He is now 42 years. He is working under the temple premises as a flower seller. He is usually uh, every day he offered flowers to the god, then only he will start to eat. Now he got fungating wound. Then it will leads to the he's having lung cancer, I think so. I don't know exactly. We went for the home care. That patient is having severe pain, but he is not taking medicine at all, because he is thinking God is punished me, so why I need to take medicine? I won't take medicine. I am taking this pain as a punishment from the God. Okay, these are all the wrong beliefs. Okay, so we arrange the priest from the temple, so he can able to talk to them. He can able to tell some example stories and some morals to the patient, so he can able to calm. Then only he took medicines. Okay, so these are all the cases are very common in fungating wound, because their total physical appearance, then family isolation, all came together to the particular patient. Okay, so we need to address the four managements here, because we need patience dignity also. Then we need to give the dignified care to the patient, as well as the physically and mentally we need to give. That's why we have to we have to treat four symptoms. Okay, ma'am, next slide. Okay, we have seen how the problems will raise, then which type of problems will rise. So now we are going to see about the assessment. Okay, now you have to imagine you are going to visit a one home care patient. Think about your patient. He is having tongue cancer. Then he is having malignant fungating ulcer in jaw area. So think about them. Think about the person. So first thing, what you will do in their home setup, or clinical setup, you are going to visit the patient. What you will assess first? What you will do first? Can anyone tell? In home, you are going to visit the patient. What you will do first? You have to answer, otherwise I'll ask questions from the participant list. Khairun Nisha, please tell. Khairun Nisha, Khairoon. Nissa, Khairun Nisha.
Please unmute your mic and talk, no? Nisa.
Okay, stands in Dolkar.
And there is one suggestion. Can you repeat the question?
What you are going to visit the patient. Okay, what you will do first for the patient? Patient diagnosis, fungating ulcer.
Position changing, madam.
What? Position changing.
Yes, madam.
That you are entering into the patient side first time, suddenly you will start to change the position. Your answer is correct. Yes, that is a main step we have seen yesterday class. But as a person or as a medical person, what you will do first? What you have to do first? It is very important because many of the home nurses or hospital nurses are facing, they are doing the great care to the patient, but they don't know the protocol, doing the assessment and take care of the patient. We have to maintain the protocol. That's why I'm saying again and again, what you will do first. Srijana said degree of wound, explain the procedure. Yes, good. Yes, if you are entering into the person, if you are entering into the patient, you have to do first, you have to first introduce yourself. That is one important thing. Then you have to know the history of the patient. You have to ask the patient name. Okay, what is your name? You have to ask the patient. If patient is not conscious, you have to ask the patient attender. You have to sure about your patient. He or she is the right person. Okay, you have to assess the patient first by asking name. Okay, you can ask to the attender, you can ask to the patient also, if patient is conscious, if patient is able to tell. Okay, then second main important thing, you have to know about their history. Okay, you have to know about yesterday what happened to the patient. You have to know. Okay, for your reference, you have to know what happened to the patient. You are entering into the ward, you are start procedure. Patient may we have one experience. One sister went to the patient room. She started to do some care, dressing. She started to do some dressing. Patient is having more pain. Patient is not able to cooperate with the sister. She recorded. Patient is not cooperated. We are not done dressing like that. She simply said, she simply written and came back and reported to the supervisor. But this real scene was, he developed the bleeding 2 hours before itself. Okay, so the maggots was present. So the at the 2 hours before itself, the one supervisor went to the patient and removed the maggots and stopped the bleeding and came back. She returned. She returned. She recorded. But after the second nurse, duty nurse, didn't see the record, didn't read the what happened before. Just she went for dressing and did everything again and again. They did to the dressing, so the pain elevated to the patient. So first thing, we have to know about the patient history. What happened before the day, what happened on the day. Okay, if you are going to touch the patient, you have to know first, you have to assess the patient. Then you are going to do the dressing on the patient. Okay, then you have to know about the wound. Okay, if you are know about the wound means you can give the more proper dressing to the clean and proper dressing to the patient. Okay, first you have to see the wound location. Okay, mobile. So in that wound location you have to see the mobility impaired. It can be easily covered or not from the public view, because patient is having some dignity, some guilt they may feel because of the wound shape appearance. So you have to know the wound. Then wound appearance, how it is appeared. It is in a cauliflower shape. We have studied, we got many references, no? So it is related to fungating ulcer. It is then you have to go with the bleed. Sorry. First, you have to go with the inspection, wound location and wound appearance. Surrounding the skin, you have to see. Then potential for complications. You have to observe any obstruction or hemorrhages from major blood vessels will happen. Like that, you have to observe, because most of the fungating ulcers are present near to the face line or jaw line and all. Here, one major blood vessel is going. Which one? Which vessel is present on the face? Major blood vessel near to the face. Participants, please answer. Which major blood vessels present near to the neck or face? So it is a very potential for complication.
Carotid
You
artery.
have to check. Very good. Then
Jugular vein.
yes,
Then
correct. So you have to check for the potential for complications. Okay. Ma'am, please scroll. Please scroll. Okay. Now we are going to see the management. Now we have till now we have discussed about the complications or problems which have been raised. Now we are going to see the management. Okay, palliation of symptoms. First, you have to prioritize the patient nursing diagnosis. Okay, you have to, before starting any care, you have to make a small care plan. Okay, first you have to prioritize, you have to write the needs of the patient. Okay, first if the patient is having pain, patient is having a wound, the patient may feel pain, they may be exudate, they may be bleeding presence, those things will be there. Then patients will have fever also. What you have to do first, you have to reduce the pain first, then you have to control the exudate, and you have to stop the bleeding, then you have to control the exudate, then you have to see the complications. Like that wise, you have to prioritize your care to the patient. Like that, first you have to reduce the pain, then controlling odor and infection, managing exudate, minimizing bleeding, and holistic care you have to give, and empowering patients and family in wound care. You have to involving their family also in the wound dressing. Criteria for wound dressing. Why we are doing wound dressing? Can anyone explain? Many people, many unaware of people will think anyhow they are having malignant tumor. It is not going to heal. Why we need to give care? It is cost-wise waste. It is material-wise waste, full of smell. Anyhow, he is not going to live anymore. Why we need to give treatment? Why need to we encourage them to do care? Many unaware people they are thinking like that, but here we are giving a holistic management, holistic approach to the patient to give the quality of life to the affected patients. Like that wise, our goal of care here to maintain or improve quality of life through symptom control. You have to note that we are doing symptoms control. Okay. First one, empathetic care you have to give. Then you have to give thorough bath before dressing. Okay. Thorough bath before dressing you have to give. Then only the bacterial colonization, then other infections, then other infestations of eggs or maggots will removed from the body. Okay. Then ensure the patient had dose of analgesic before dressing. You have to always ensure, if you are going to start the medication, means you have to give the analgesic to reduce the pain. Then only you can give a proper dressing care. Okay. Then use normal saline for cleaning the wound. Okay. So use normal saline for cleaning the wound. You have to select dress here. Okay. Ma'am, next slide. Here you are going to study how to minimize the pain. Deep pain, aching, stabbing, and continuous pain, adjusting systemic analgesics. With the doctor's help, if the patient is having deep pain, means you like aching, stabbing, continuous pain, means you have to adjust the analgesics. Okay. Then superficial pain means burning pain, pricking pain due to the dehydration, due to the dry skin. I am having irritation pain, means you have to go with the local applications like sensorocaine, lignocaine you can use. Okay. So these the minimal step to minimizing the pain here. Next, ma'am. Okay. Now I'm going to step by step I'll tell. First, you have to reduce the pain. You are giving analgesic. Then you are going to start the dressing, as well as you have to clean the wound with the help of normal saline. Okay. Daily cleaning and dressing is mandatory for the fungating wound patients. With the help of metronidazole powder, you can crush and mix with the normal saline or petroleum jelly. You can apply on the wound. You can use the gauze pieces, clean gauze pieces. Okay. For the dressing irrigation, you can go with the IV metronidazole. You can use the metronidazole, that irrigation liquid is available, so you can use that. So before giving the dressing to the fungating ulcer patient, if the patient is having more exudate, more and more smell, more bad odor, means you can go with the all of you experience what you will do in your setting. If the patient is having mole odor, or if the patient is having a very bad exudate, what you will do in your hospital setting or in your clinical setting? The patient is having dressing, you will do every day. But if the patient is having more mole odor, what you will do?
Applying the pressure.
What, sir?
For bleeding, the madam.
No. If the patient is having more exudates and for bleeding, you can go with the adrenaline pack, then those things you will use. What you will do for the bad odor is coming, then exudates are also coming. The pus like things like coming means what you will do?
Daily dressing, madam.
Daily dressing only. Okay. You people are doing daily dressing now. Till now you are doing daily dressing and cleaning and dressing only. Am I right?
Yes, madam. Yes.
Okay. Hereafter, you can try metronidazole nebulization. Okay. Which is the thing I have observed and I have practiced in Pallium, India. We are having that nebulizer kit, no? For the kids, we are using that mask and nebulizing kit, no? To dilute the what things we are using for salbutamol. Are you aware of
Yes, ma'am, is
nebulizer kit?
using for
No?
bronchitis patient.
Yeah. To remove the to dilute the bronchitis infections and all we are using, no?
Yes, madam.
So you have to remove the mask now. You are pouring one tablet in that kit, no? Can you imagine? You will pour
Okay.
salbutamol, normal saline in that one small tube in nebulizer. Then you will start the button. Then the mask will be provided to the kit. Then it will start to gasping, no?
Yes, sir.
Now you are using metronidazole powder or you are crushing metronidazole powder. If you want, you can add 1 ml, 2 ml normal saline. You can add. Then the gas will come. You can take that pipe. Then you can little bit show. You can show on the wound, fungating wound. Okay, it will help the wound to reduce the exudate in effective way. Okay, you keep the nebulizer kit for this purpose only. You should not use for others again. So you can keep and you can crush the metronidazole powder or a tablet or metronidazole irrigation liquid also you can use. You can pour it on the pour kit and you start the machine means it will the gas like thing will come from the crushed metronidazole medicine. So you can show on the like you can show on the affected part. So it will give effective way to reduce the exudates. Okay. Hereafter you can try after the practices after I have observed from the Pallium India hospital. We are doing in our hospital setup here. We are getting more effective effectiveness from the patient side. Okay, you can use so this is one type of dressing way. Then as well as you can go with the metronidazole irrigation and you can go with the large type gauze pieces to prevent the exudates from the wound. Then you can go with the regular dressing. If otherwise the exudates are coming more way means you can go with the napkins also to absorb more exudates, to absorb more pus cells. Okay. For mole odor, you can use the charcoal under the bed of the patient. Okay. Then you can go with the negative pressure wound dressing therapy. But negative pressure wound dressing therapy, you have to use with the proper guidance. If it is not, means the tissue cells and skin, normal skin surfaces also will be damaged. Okay, these are all the techniques for dressing and control malodor. Next one. Okay, these are all the methods to control bleeding. Okay, then apply local pressure. Sucrosulfate powder you can apply. Tranexamic acid you can apply. Systemic ethosamylate you can go with that. Palliative radiotherapy, if it is needed, means the patient can able to do, means the patient is willing, means we can go with the palliative radiotherapy. Then adrenaline pack is enough to control the bleeding. Okay, next slide. Here, role of cancer therapy. Many of the patients, they won't aware of their getting malignant growth. Once it is diagnosed, it is malignant, fungating wound, malignant Majoline ulcer. If it is, means we can ask the doctor if the patient is able to do in all ways, means we can go with the radiotherapy, then cytotoxic chemotherapy, and then hormonal therapy and surgery also we can go with, if the patient is willing, if the patient is if the patient is ready for that, means we can go with the cancer therapies to reduce the fungating wound, so reduce the risk of the fungating wounds. Next slide. Yeah, yesterday itself we have seen about the maggots, whatever the wounds, it may be pressure ulcer or Majoline ulcer or fungating wound. If the mites or mosquitoes or sit on the wound, means it latching the eggs, means it will develop as a maggots. One each is enough. One fly is enough to produce a lots of maggots. Okay, it is a disgusting moment to the patient as well as the attender too. Okay, so we have to advise the attender or caretaker to provide a clean environment, especially mosquito free or mites free environment to the patients. Okay, they have to use a very neat and clean cloths to cover the wound, to cover the wound, to laying on the bed. They have to use a clean things to reduce the risk of the maggots. Previously, I have said you can use the turpentine to remove all maggots from the patient side. Don't force, don't pluck the maggots, don't give more forces on the wound, because it is elevated pain, as well as it will damage the capillaries, it will damage the major blood vessels too. So the complications will be improved to the patient. Thank you. If you are having any doubts, means you can ask. Or you can leave the comments, or otherwise I'll start to ask question.
Dear participants, kindly ask your doubts. It's a very important session in palliative care.
Yes.
So, Vinod Kumar, how was the session? Or else you can ask the doubts. So I'll share the PPT on the IUCO platform. You can message me directly. So
How to handle with burn? Can you put it on set, ma'am? How to handle with burn? Which type of management you want in burn, Sister Sonam Nandun? What you are asking? For every wound, you have to first assess the wound stage. Okay, in burn wound also there is stages are there. Burns burns are having degree. Okay, first you have to assess the degree of the wound. Then which stage burn is present to the patient. Then if the patient is having second stage of burns, it is going into the subcutaneous level, means you have to go with the debridement every day, and you have to treat them with the fluid replacement. In burn injury, fluid replacement is the major treatment. So okay, you have to do the fluid replacement. Then you have to go with the hydrogel and what is that, lignocaine with what, Miss Sonam Nandu, which ointment you will use in your area?
Silver sulfadide, ma'am.
Ah, sorry, silver sulfadide.
Yes, ma'am.
Okay. If the patient is having more pain, means you can merge the silver sulfadide with the lignocaine ointment. Okay. You can mix with the lignocaine gel and you can apply on the area. Then you have to do the fluid replacement. You have to take the fluid calculation first. The patient is having deep wound, means you have to do the fluid calculation, because overload of the fluid also leads to the complications to the patients. So first thing, you have to assess the degree of burn. Then you have to go with the dressing. Then you have to remove the cloths which is attached on the burn area. Then you have to remove the extra things, if the patient is having if the patient is having on their skin surface like ring and the metal things, you have to remove. Then you have to go with your sulfur sulfoxide which is available there. You can medicate them with the analgesic. Patient, you have to medicate with the analgesic. Then according to the degree one itself, you can treat the patient. Fluid replacement is main theory, you have to go with that. For pain reducing, you can use the any ointment with the help of lignocaine gel. Here we are using like that only. Then if it is needed, means you can go with the debridement of the damaged cell. First, you have to give the confidence to the patient, because patient is having more pain in the burn cases. So you have to give psychological support to the patient first. Any other questions?
Shabnam?
I think no doubts. It's everything is clear, I think.
Hope so, ma'am.
Uh,
So,
so thank you so much, ma'am. It was a
so
wonderful session.
yes,
Thank you,
Continue,
ma'am.
Hannah.
Thank you.
Please continue.
really, thank you so much, ma'am. I know you're not well and you are joining from hospital.
Thank you,
Thank you,
Sahana.
ma'am. Thank you for the extra effort and